Hello, my name is Jody Covert, and I'm the Director of Nursing here at the Truckee Meadows Community College Maxine S Nursing Program. And we are going to cover prerequisites, requirements, and hopefully answer questions. If I don't answer your specific question, though, please give Amber, our nursing administrative assistant, a call, and she can be reached at 775-850-4054 at any time.
Hi, I'm Jennifer Pierce, Academic Advisor with TMCC. We're going to start by talking about some of the advising related topics for applying to the nursing program. So we'd really love you to make sure you meet with us as advisors to talk about all the pre-nursing prerequisites, the things you need to know about application to help you plan your courses and your best pathway towards applying to nursing. So what we do in academic advising is assist students in understanding the coursework, the GPA, and the application process to be considered for the program. We can also help with planning courses and how you sequence classes that are required and the recommended things that you need to have ready to apply to nursing. If you're a transfer student with credits coming in from another school, we will help with the unofficial evaluation of your transfer work to understand how that applies towards nursing and look into any possible course substitutions that you need to have in place before application. A couple of things to keep in mind about the nursing program and things that we can discuss in an advising appointment. Nursing is limited entry. It does require an application. They admit up to 40 students twice a year. The application is due in the spring or in the fall. So if you apply in spring, and you are admitted, you would start the program that following fall semester. And if you apply in the fall, which is typically in September, and you are admitted, you will then start the program in spring. Again, the deadline for fall admissions is May, meaning that you can have courses in progress during that spring semester and still be able to apply and get your application in on time by May. Keeping in mind that the deadline for spring admission is mid-September, so you need to have courses completed by that previous spring or over the summer in order to have everything ready to go and apply. All of the pre-admissions requirements must be completed prior to applying to the program, so do keep that in mind. And of course, again, that's something we can help with in the planning, is mapping out the sequence of courses and making sure you get them completed on time to get your application in at your desired timeline. Some other things to keep in mind: admissions requirements and any changes to the program can be found on the nursing website, as well as with the steps to apply. So it's very important to continually check that website just to see if there's any updates, any new information. And of course, that's something that we can help you understand if you're meeting with us on a regular basis. Also looking in the college catalog. So since you can't declare nursing until accepted into the program, you'll still want to be looking at the nursing degree in the catalog to understand the courses you would need to take. So both of those, the catalog and tmcc.edu/nursing, will be two online resources you'll want to check out, and also things that we can help you understand during advising appointments. Keep in mind too, with the catalog, since you can't declare nursing, that means you don't have catalog rights to that program. So if there are any changes, you'll have to follow whatever changes are implemented by the time you apply. So again, another reason to meet with us on a regular basis. We suggest at least once a semester. And then also be checking the nursing websites and the catalog for any updates that you may need to follow if you haven't yet applied to the program.
All right, hi, I'm Courtney Heitman, and I am another advisor at the TMCC Academic Advising Center. And along with what Jennifer was going to talk about, I'm going to talk about the pre-admission requirements to get into the nursing program. So one of the first things that they're going to look at is GPA. And the GPA that they're going to look at is for all previous lower division college courses leading to the Associate of Science in Nursing. That GPA has to be a 2.75. So we're not going to be looking at all of the coursework that you've taken within your college career. we're only going to be specifically looking at the courses that work for the nursing degree. So on the left-hand side, you're going to see the recommended courses that you have completed prior to applying to the program. And on the right-hand side, you're going to see the required courses that they want you to have before you're applying into the program. So for recommended, they want you to have your college level English completed, and that would be English 102 or English 114. They also want you to have a course that meets the fine arts requirement and the humanities requirement. And social science, they're specifically wanting you to have Psychology 101, which is general psychology. And then they also want you to have 1 or 2 courses that will meet what we call the US Nevada Constitution. So again, these are just recommended courses, but if you do take them prior to applying into the program, your grades will count towards that GPA that they're wanting you to have. And then with the required courses, the first thing that they want you to have is Math 126, which is pre-calculus or higher, and then Biology 190A with Biology 190L, which is cell and molecular biology. This course is only required if you're taking anatomy and physiology and microbiology at TMCC, because Bio 190A and Bio 190L are prereqs to get into your anatomy and physiology and your microbiology courses. They're also going to want you to have Bio 223 and Bio 224, which is anatomy and physiology 1 and 2, and then Bio 251, which is microbiology. So again, you have your recommended and your required courses. All of this coursework will factor into that 2.75 minimum GPA that they're wanting you to have. And then along with that overall GPA, there's something called the science GPA. And the science GPA consists of your 200 level biologies. So Bio 223, Bio 224, which is anatomy and physiology 1 and 2, and then Bio 251, which is microbiology. Those courses combined have to be a 3.0 or higher. So B's or better in those courses is what we typically recommend. Just some things to keep in mind when you're taking or transferring in your 200 level biologies. They have to be taken within 5 years prior to applying to the program, so they can't be older than 5 years. They can only be taken twice within that 5-year period. And withdrawals, audits, and repeats are always going to count as attempts for that two attempts within a 5-year period. If you're transferring in these 200 level biology courses, we really, really want you to meet with us in advising to make sure that the courses that you took at your previous institution articulate exactly as Bio 223, 224, and 251 at TMCC. So in addition to the coursework, there will be a pre-admissions testing. We call that the HESI exam. And you're going to be tested in anatomy and physiology, biology, math, grammar, reading comprehension, and vocabulary. Each of those individual sections will be scored, and you have to get a 75% on each section in order to be considered for the program. You have to take the HESI at TMCC, so you can't go to another institution and take their HESI exam and transfer it to TMCC in order to apply into the program. And then one other thing to keep in mind with this pre-admissions test is that it can only be taken 2 times in a 12-month period. And you can only repeat the different sections that you scored less than 75%. So if you got a 75% in anatomy and physiology, but then you got a 74% in biology, the only section there would be that you'd have to repeat the biology section. Along with the coursework and the pre-admissions testing, you also have to have a copy of a current state certification for certified nurse assistant training, or complete an approved CNA course with a grade of a C or better within the last 5 years. So if you've come to TMCC and you don't have certified nurse assistant training, you can take that here at TMCC. We call that Nursing 130. It's a 6-credit course that we typically offer in the fall, spring, and summer. There are no prereqs to get into the course, but there are pre-registration requirements, and the website is listed there. So typically I let students know that if you are planning on taking this in the future semester, you want to make sure that you have those pre-registration requirements into the CNA department before the registration period starts for that semester.
So one of the questions we often get asked in advising is, how long will it take me to complete the pre-admissions requirements? Really looking at what's that timeline for me as a student to get ready to apply to the nursing program. And the answer we usually give is it depends. So it depends on a couple of factors. Where do you start with your math and English? These are gateway courses into biology. So if you place right into Math 126 and English 102, then you're going to have those prerequisites to those biology classes pretty soon. But you may need to take something like Math 96 first, or you may need to take something like English 100 first, which is going to take you a little bit more time to get those prerequisite courses to your biology. So that's one of those factors we talk about with students, is where do you place with your math and English? But we can also help you map out then when will you be ready to take the rest of those prerequisites. Another factor we often talk about with students, are you going to be attending full-time or part-time? And every student has a different situation. So if you're working full-time, you probably aren't going to also balance full-time school schedule. If you're able to fully concentrate on school, you might be able to go full-time and get through some of those prerequisite courses sooner. So it really does depend on your personal situation. And remember, it's a marathon, not a sprint. We are here in advising to help you figure out how can you best, in your own personal situation, complete these courses to meet your goal of applying to the program. Another factor, as we mentioned, the deadlines for application and when you will be finished with the pre-admission requirements. So that's another area where we often help students map out their coursework so they know they will have things completed and take the HESI and have all those requirements ready to go by the time the application is due. So this information shows how some of these courses might be sequenced. A lot of students will take Math 126 and English 101 prior to taking Biology 190 with the lecture and lab. However, students that might be going full-time and able to manage a full-time course load can take Math 126 and English 101 as co-requisites with Biology 190, meaning they can be taken in the same semester. Biology 190 and the lab then are prerequisites to Biology 223 and to Biology 251. So Biology 223 and Biology 251 can be taken in the same semester, but it's highly recommended that you split those up so that you can concentrate on each of those 200 level biology classes to meet that 3.0 GPA that's required for the nursing program. And Biology 223 is then the prerequisite to Biology 224. Sometimes those are offered as fast track courses in a semester where you can take 223 the first 7 weeks of the semester and the 224 the second 7 weeks. Again, keeping in mind your personal situation, how you do in those classes, it may be recommended that you take those biologies in separate semesters. Again, this is where, with advising, we can help you really map out and match that up to whatever your personal situation is to make sure you're successful. So again, keeping in mind part-time versus full-time, where you place with math and English, other factors in your life and how you can manage to be successful in these classes. This is just a sample education plan of how these might be sequenced in order to apply to the program. So for instance, this student placed into Math 126 and English 101. So in their first semester, they were able to take both of those along with Biology 190 in the lab. The next semester then, they were able to take that Biology 223 class, the second English, and fit in a fine arts. Over summer, they did Nursing 130 for the CNA requirement. That fall semester, taking Biology 224 and Humanities. And then in that last spring semester, Biology 251, picking up a course for US Nevada Constitution, studying and taking the HESI, and then being able to apply by May. So just a sample of how that might look. And again, keep in mind that your courses and your own plan may look very different from this. Important things to keep in mind when planning this are those prerequisites, how much time you have to study, again, full-time versus part-time as a student, the applications for nursing, and other variables.
All right, so if you're a transfer student coming into TMCC with previous college credit, or if you took advanced placement in high school, we really want you to send your official transcripts for both your previous college credit and your advanced placement. It does have to be an official transcript, and it does have to be sent directly to our admissions and records office. Along with sending that official transcript, we really want you to also complete what we call the transfer credit evaluation form, which can be found on the admissions website, which the link is right there on the PowerPoint. The reason that we want you to do this as soon as possible and get that form into our records office is that your transcripts can take anywhere from 4 to 6 weeks to be evaluated. So the sooner you do this, the sooner we're able to kind of put that ed plan together with all of those pieces from your previous college credit. Also, nursing is now requiring all of their applicants to meet with an academic advisor to review their transfer and AP credit and how it applies to the nursing program. So advising has an online scheduling tool that students can go to. They just go to myadvisor.tmcc.edu and you can schedule your own appointment in order to meet with us. And so right now, during this time, we are offering distance advising appointments. All of our advisors are trained in pre-nursing requirements. So if myself or Jen, we are not available or our schedules don't match up, please feel free to schedule with any of our advisors, because like I said, they are trained in all of the pre-nursing requirements. So again, you would just go to myadvisor.tmcc.edu to schedule your distance advising appointment. Once you schedule that appointment, our front desk will send you a Zoom link that you just click on, and then we'll be able to help you out with your questions.
So Jen and Courtney went over all the prerequisites, the path to apply to the nursing program, but I do get a lot of questions from students on how do we look at applications? And so the way that applications are looked at is we have 50% of the overall score contributed to the HESI, and then 50% the overall GPA. So as the academic advisor stated, the first thing we do is make sure that your biology 223, 224, and 251 are cumulative 3.0 or higher. If they're not, we don't look at the application. So once we look at that, then we look at the overall GPA, all courses that would apply to the Associate of Science in Nursing. That combined must be a 2.75 or higher. That makes up one portion, or 50% of the application. The other part of the application comprises the HESI. And so as the advisors were talking about, we have to have a minimum of 75% in each section. You are allowed to take it twice in 12 months, but only if you scored a section that was lower than 75. So if you scored a 76, that is the score that stands. The calculation for the HESI is a little bit odd. We add the scores together, we take an average, and we divide that by 25. It gives us a GPA point number. So for instance, if you had a 3.2 overall GPA and a 3.2 in the HESI, then your overall score would be a 6.4. We do that with every single applicant, and we rank order them from 1 until we get to the end, and we admit the top 40. We always save a few students just in case there are students who decline their application or things like that. Now, as you know, you have to take biology 223, 224, and 251, but we do require certified nursing assistant. You either have to be practicing as a CNA currently or have taken and passed a class that's certified within the last 5 years. Now, a lot of students will just take the class but then not sit for the state exam. They'll just have passed the class. That is acceptable as well, but I always encourage students to find work as a CNA because it's a great way during summers and breaks to get your foot in the door in the facilities and also gain more hospital experience. A lot of students ask me, why do I have to take CNA? In the nursing program, on day 1, we expect that every single student is independently proficient with all the CNA skills. We do not teach the CNA skills anymore. We start right out with nursing-based skills and techniques in the nursing program. So you must have that CNA background before you apply to the nursing program. I also get questions on EMT and paramedic, and unfortunately, or medical assistant. And unfortunately, those don't meet the same curriculum guidelines as the CNA. So we do take the CNA, and sometimes on a case-by-case basis, we will make exceptions, but that's something that you would have to speak with me about on a one-on-one basis. Once you are admitted to the nursing program, you will receive detailed instructions from myself and Amber on what you need to do next. As you will find when you enroll in the CNA program, there are requirements. You have the same requirements when you apply to the nursing program. You have to have record of all your immunizations, and that includes your MMR, your Tdap, your TB test, flu shot if it's during flu season. If you don't have your history of your immunizations, you need to get started on that immediately, and you'll need to do that before you apply to the CNA program. The problem is that if you don't have any record of it, you have to have titers drawn, and that can be very, very expensive, depending on when you're doing that. So once you get into the CNA program, or if you're a practicing CNA, keep all your requirements. Don't let anything lapse, because it's quite expensive, timely, and it can cost you days away from your CNA job if you don't keep your requirements up to date. In addition, you must have major medical insurance when you are in the nursing program. That has to be consistent throughout the entire 2 years that you're in the program. In addition, you must have a current American Heart Association CPR card. It must be healthcare provider CPR. Now, if you're confused or concerned if the class meets those AHA guidelines, please call the nursing program. There are a lot of courses out there in the community online, and they say they are like, or they follow the recommendations of the American Heart Association, but they're not. And so the clinical facilities will not take those cards. And that's an added expense, $50 to $100, depending on where you take it, if you take the wrong class. So again, please make sure you take an AHA certified course. TMCC does offer an excellent course as well at a discounted rate for students, so you can always go to the tmcc.edu website, search in the bar CPR, and it will take you to our CPR website as well. That must be updated and done on every 2 years while you're in the program, and then for as long as you're a registered nurse as well. In addition to those requirements, you have to submit to a drug screen and a background check. The drug screen comes back to the nursing program either saying clear or not clear. Sometimes we get drug screens back that say diluted, so that could be that you had too much water or too much liquid to drink. Unfortunately, they won't read that, so if it comes back as diluted, the program will make you submit to another drug screen. So again, keep that in mind when you are submitting for the drug screen. The other thing that you have to do is submit to a background check. Now, the background checks do not come to the nursing program or to the college. The results of your background check go to all the clinical facilities in the community. Each facility either says yes or no to that particular student. If one clinical site in the community says declined for student X, then you will not be admitted into the nursing program. So again, keep that in mind. If there are things in your background that you're concerned about, please don't reach out to me. That would be something that you would need to reach out to the background company, because again, I don't look at them. The clinical facilities do look at the background screens. A lot of students like to ask, what does it look like to be a nursing student in the nursing program? I can tell you with 100% certainty, it is the hardest thing that you will ever do, but it is also the most rewarding thing. I have been a nurse for over 25 years, and every day is an excellent day, but it requires 100% active commitment while you're in the nursing program. I tell my nursing students on day one, please just give me 150% of your time for 15 weeks, and then you get a break. So again, if you're working full-time and you're having issues with classes in the prereqs, it's probably not going to be feasible to work full-time and then come into the nursing program. What I also tell students is try and work a lot over the summer and a lot over the breaks so that you can put money away so that you can live while you're in the nursing program. The other good thing is that we have wonderful community donors who donate so much to our foundation and our scholarship programs for nursing students. So once you are admitted into the program, we also encourage you to meet with the scholarship people, and we have students apply for scholarships to help them get through the nursing program. So the other thing that you need to keep in mind is that every single book that you will be using in the nursing program must be purchased during the very first week of school. And it can be upwards of $1,800. So that's something to think about when you're applying as well. Now, students always ask, we'll never use all those books, will we? Yes, you will. I promise. You will use every single book within the very first semester of the nursing program. So please keep that in mind as well. That is a huge added expense, but then you're done for the entire program at that point. The other thing you need to think about is the time commitment. We are in theory during the first semester most of the day on Monday and half of the day on Thursday. And then you're in clinical, lab, or simulation all day Tuesday, all day Wednesday, selected Fridays, and clinicals on Saturday as well. So it's a huge time commitment. In addition to time spent in the classroom, you need to make sure that you're spending at least 2 to 3 hours per class per week outside of the class time. And that's not time spent alone, that's time spent in study groups with other nursing students. We've found over the years that the students that are successful study together and not alone. So the way that we all studied alone in microbiology and anatomy and physiology, memorizing things does not work and does not make for a successful nursing student once you're in the program. We can't work in silos, unfortunately. We have to work as a team, which is what we do as nurses anyway. So we have to have those study groups formed on day one of the nursing program. So if you have any questions, please reach out to us. Again, you can reach us at 775-850-4054. We are always here to answer questions. Once you are admitted into the program, we are a family, a community. We are here to help each other, and so we want to make sure that all our students are successful, but you need to make sure that you do your part to make yourself successful in applying to the program. I look forward to seeing you. Bye-bye.